All right. Uh, excuse me. So I'll be talking about a study that we did on understanding daily and event level experiences of intersectional stigma for sexual minority men of color. I tried to keep the slides briefer, but we'll try to get through this quickly so that there's more time for discussion about some of the implications. So I'll just breeze right through this. So I use event level measurement in a lot of my research to better understand the experience of stigma as it fluctuates from day to day, so that it better captures sort of the lived experience of stigma as opposed to dealing with all the issues of recall bias and whatnot that we experience with individual level measurement. I'm going to actually skip this part. It's not super important for the intersectional stigma piece. There were a couple of papers that I was involved in that sort of validated the use of event level measurement of intersectional stigma and showed...
John, could you, number one, say what event level measurement is, and number
Sure.
two, maybe just briefly how you're defining intersectionality?
Yes, so event level measurement would include various forms of measures that are done typically on a daily or sometimes even multiple times a day basis. So that would be like daily diaries, ecological momentary assessment. So most of my studies are either 1 to 2 times a day. Typically folks have like 4 hours to complete a survey and they're paid for each report. So in this study, we had 371 sexual minority men in New York City. And this study was the first one to capture the experience of gay-related stigma on a daily basis. And just what I'm showing you here is that the results showed that over and above between-person level in sexual minority stigma, the daily capturing of sexual minority stigma, a person's fluctuation around their own average levels of intersectional stigma had a significant impact on these various outcomes, which were positive affect, negative affect, and anxious affect on a daily basis. So basically just showing that there is a mental health, a daily sort of acute mental health impact of, in this case, just sexual minority stigma on gays.
And was this internal, external, enacted? What kind of stigma?
This is more general. It's all, it didn't really tease those 3 things out in this study. The next study did tease those things out. So this is specifically HIV stigma. So none of these are intersectional stigma. All of these are specific types of stigma. So this is a study that I did with my K award several years ago. It was 50 sexual minority men living with HIV in New York City. And this one again showed that over and above between person experiences of HIV stigma, which is how I typically feel, what my average level of HIV stigma is, on days when folks reported greater experiences of internalized HIV stigma, that had predictive impact, again, on very similar outcomes: anxious affect, depressed affect, and emotion dysregulation on the daily.
Is there a significant difference between anticipated and
So anticipated stigma didn't have a significant effect in any of these models. It was just the internalized stigma in these models. And then so these led to the desire to better think about how we can do intersectional stigma research at the event level, because a lot of times approaches to intersectional stigma research to quantify intersectional stigma have involved capturing different types of stigma and then creating interaction terms between those different types of stigma, but there are a lot of issues with that, especially if you're thinking about daily reports, because then folks have to report on multiple different types of stigma or multiple different domains of stigma every single day, which is very overwhelming. So NIMH had an RFA on intersectional stigma several years ago, and we submitted an R21 for that. And the R21 had 3 phases that included a systematic lit review and qualitative interviews with both sexual minority men themselves, as well as experts that work with sexual minority men of color. We then did a lot of cognitive interviewing of the scales that we initially developed based on those interviews, and then did a daily diary validation study. And the goal here was to understand how to capture intersectional stigma at the event level, and then to develop validated scales to do so in future research. So in phase 1, we conducted 19 interviews remotely with folks around the country. So this was a national study. And as I said, we interviewed both young sexual minority men as well as folks that have expertise in working with those populations, either from a clinical perspective or from a research perspective. And we identified several themes that I'll talk about on the next few slides with some quotes, but one of them is that intersectional identities are inextricable, and so like this idea of like let's capture racial stigma and sexual minority stigma and create an interaction term with them, that's really challenged by this one. You know, it undermines the idea that you can quantitatively create those interaction terms, that folks can easily separate out those experiences. Intersectional identities provide opportunities for resilience and resistance, so you'll see that folks talked a lot about that these scales shouldn't only be negative. Identity salience is context dependent, and space and place are critical. So this space and place piece became a really important theme that really informed a lot of the measurement development. As a social psychologist, obviously I was trained to think a lot about stigma as an interpersonal experience, and folks really talked about the ways in which they don't need to be interacting with another person to experience intersectional stigma, that the spaces and the places that they're navigating on a daily basis are a source of stigma for them, particularly around safety in those spaces. And then also to think about process and not content, which is really also where this event level measurement comes into play, to think about stigma not as like a static thing, but as a dynamic process that occurs over space and time. So in terms of intersectional identities are inextricable, I have some quotes on each of these slides. But so in some cases, for some people, stigma experiences may be attributed to a specific identity, but this is overly simplistic, right? So intersectionality has to do with the fact that folks have overlapping and intersecting identities, and even more than identities, social positions, right? So a lot of people talk about intersectionality and they talk about identities, but really intersectionality is about systematic forms of oppression and the ways that people's social positions place them into positions that create stigma and oppression. So racism persists in queer spaces, and that has a strong effect on people's identities. Even when you order your own identities, people have to recognize that other aspects of your identity can have an impact on your other identities. So like people were basically just saying, I don't know how to answer a scale when you ask me to report about my racial identity separate from my sexual identity, because my experiences of racism are sexualized, my experiences of sexual minority stigma are racialized. The way we experience the world is a result of all those identities being intersected. Because of the intersecting identities that they hold, the social locations that they hold the stigma can happen. So we shouldn't promote the idea of someone being only one part of themselves. So people just really were pushing back against this notion that we can ask people to easily tease apart their experiences of stigma as being relevant to only one of their identities or social positions.
And John, that's what I was going to ask. Like, how does this really differ from like the general perception, the work that NIH funds? Because everyone's coming up with obesity, stigma scales, you know, just so many dimensions of stigma.
Yeah. I mean, I think it's really tough. I spent a lot of my career looking at specific forms of stigma.
Okay.
I don't think that it means that work is totally invalid, but I think it really challenges us to push the field forward in new ways. So we thought a lot about that, and I'll talk. I don't really have any slides on the cognitive interviews, but I'll talk a little bit about where we landed in terms of the scales that we developed and how we did that to sort of respond to these questions and critiques. And just so that folks are aware, we were telling people specifically that the goal of these interviews was to develop new measures, and that we really wanted to understand what they thought about these various aspects of the way that we do this measurement. So that's, you can hear people like literally saying, like, well, I can't answer a question when you ask me to do it that way.
Yeah,
That's great. It's really interesting. And I'm not really familiar with the literature, but I'm wondering, the resilience is obviously a really interesting aspect of what was identified here. But are there other aspects of identity that you tapped into that may address the issue of resilience? In other words, did you tap into other aspects of identities other than the intersexual ones, sexual minority status, race, whatever? You can look at other aspects of identity.
Well, so for right now, we're just in the qualitative study that's like asking people to help us think about how we can better ask people about their experiences of intersectional stigma. So in this study, we weren't tapping into anything other than trying to define those things. I can talk, if there's time, about the ways that we're now moving forward with using these scales in some of our work. So this next slide is the one about resilience and resistance. And this is where people were basically saying, like, please don't depress us by asking us only about negative things. And also that, like, yes, we're stigmatized, but that also we have power and we are agents in our lives and we resist that stigma in creative ways, and it helps us to form community. So certainly not saying, like, we're glad we have stigma, but that you should consider the contextual factors of stigma, that it's not only a negative experience, that we are able to fight stigma as well. So this person said, the people that I'm closest with and my strongest relationships came out of shared stigma, even if it wasn't something I was personally stigmatized against. There's a sense of camaraderie, shared intersections of stigma, I feel like, is linked to community, solidarity, friendship, and a shoulder to cry on. Stigma is a beautiful glue. Identity salience is context dependent, and space and place are critical. So there's a tension between racial, ethnic, and sexual identities in some situations. Intersectional stigma has to do with how a person interacts with not just other people, but the environment. So having the capital to go to spaces that may be more accepting than others, or the resources to access, to support, or express yourself, or feel you can be who you are. So this was a huge thing. Basically, these interviews really highlighted the fact that feeling safe within a space is a form of privilege, and that one of the key features of intersectional stigma for folks that have multiple marginalized positions, as opposed to folks who may really only have one axis of a stigmatized identity, is that you can, the experience of intersectional stigma is one where you can't choose safe spaces because one of your marginalized social positions is always going to be stigmatized in one of those spaces. There are very few spaces that sort of celebrate and uplift people with those multiple marginalized identities without any stigma for any of their social positions. So for example, we did interview white sexual minority men as well, and in this case, basically, like, white sexual minority men have the opportunity to go to gay spaces where they won't experience racism, and they can be celebrated there. So they're able to choose safer places to live, so like the idea of, like, gay men who move to a big city after they come out because they feel safer there. That isn't necessarily an option for folks that have intersectional marginalized social positions, because there's always going to be a lack of safety due to at least one of their social positions in every space that they enter. So they really talk a lot about this burden that intersectional marginalization causes. We take publicness and public space for granted, but minority people who sit at intersections, these kinds of privileges of walking or traveling, or even the notion of public space, doesn't seem like they have the privileges or rights to. Public space is made for men, straight, white, gender conforming. It's embedded in who we understand is deserving of those spaces. So this was also really important for us to think about. So we obviously took space as a critical factor in the development of these scales. And one of the things we had to think about was not just like work and home, but also walking down the street, walking to the subway. Like, how many different spaces do people encounter on a daily basis? And actually one of the things that we learned from these interviews is that having intersectional identities, having multiple marginalized social positions, means being much more space aware than folks who, for example, the white sexual minority men, didn't really think about space in the same way, because they weren't constantly navigating the different spaces that they were in and shifting their behavior across those different spaces. So that, again, that sense of safety as a form of privilege was really highlighted here. And then process, not content. So intersectional stigma measurement should take into account not just how stigma looks or how often it happens, but how it becomes part of a person's narrative. So when we started these qualitative interviews, we were really looking to develop items that would capture the experience of intersectional stigma for specific groups of intersectional identities. So we, for example, were looking for what items would best capture what intersectional stigma looks like for a Latino young sexual minority man, or for a Black young sexual minority man. And the idea of developing those kinds of items was like totally thrown out the window by these interviews. That when we would literally ask people to say, like, how does stigma look different for a Latino sexual minority man than for a white sexual minority man, or for a Latino sexual minority man than for a Black sexual minority man? And they weren't able to give any examples. So like the examples that they would give would be racism. So it wouldn't be intersectional. It would just be that the differences are that those folks also experience racism. And so we realized that it's not about the content, that we couldn't develop items that would classify the experience as intersectional, that the intersectionality was really in the pervasiveness of those experiences, so that it wasn't about the content of the stigma. The stigma didn't look different. So black sexual minority men versus white sexual minority men, the stigma didn't look different. They were just experiencing racism in more spaces and had fewer opportunities to navigate themselves out of a sense of safety, or into a sense of safety. There were also some interesting points about ethical considerations that I wanted to add to this presentation that I think are really interesting. So participants wonder, who are you? How do you relate to me? Why should I share with you? What is this data going towards? Is it to elevate the PI's career or to implement policy and interventions that will ultimately help the communities we're working with? So this was really about, you know, the situation and position of the study team and making sure that the intentions are good, that you are communicating the purpose of the study to participants. So this is, I think, a really important ethical consideration, and I think also can challenge the validity of some of the research that has been done to date, to the extent that communities may have been thinking these things and didn't really feel like they got the answers they wanted. So they may still participate, they may, you know, join the study and, you know, get the money for joining the study, but the results may ultimately not be as meaningful if they didn't find satisfactory answers to these types of questions. Understanding the emotional impact for someone of talking about an experience for which they didn't have language. What is the aftermath of these questionnaires? How can we avoid re-traumatizing people? So we've talked about this here for many years now, about the ways in which doing stigma research is in itself a stigmatizing process. One of the ways that we actually move forward with this is that we don't actually ask people about stigma in the scales that we develop. We don't ask them to think about any of their identities in the scales that we develop. So I'll say a little bit more about that in just a minute. And get community members involved and stakeholders who embody the lived experiences we're trying to capture before developing the scales. So this was, I think, very common sense, but it's still important to hear. So some of the key considerations that we took into account when we developed the scales for event level studies: avoid focusing on extreme experiences. So this, I think, is obvious. Most folks do not experience violence often enough that it makes sense to ask about that type of experience in a daily study. And I think the trauma of asking in a daily study far outweighs the utility of possibly capturing one event of that or two events of that in a 3-week cycle. Avoid trying to tease apart identities or isolating the driving factor. This, I think, for a lot of stigma research, with the best of intentions, we really wanted to say, like, look, it's like this type of stigma that is driving this. We really need to create laws and create policies that reduce this type of stigma. Folks had a lot of issues with the idea of like saying that it's the result of this one and not this one, or like creating a hierarchy of stigmas. Quantifying stigma should go beyond tallying the frequency and the range of experiences. Add a focus on both positive and negative responses to stigma. Consider not just social interactions, but also relations to space and place. A general sense of safety and belonging within spaces is an experience of privilege. Consider indirect capture of intersectional stigma, and intersectional stigma as the association and not the variable. So this is where I'll say that, so what we ended up doing was we created one scale that asked people to think about all the spaces and the places that they were in that day and to report on how they felt. So we gave them a whole list of feelings, and they reported on about 12 different feelings, positive and negative, across the spaces that they were in that day without having to think about any of their specific identities, just like how did you feel across spaces and places today. We then did the same thing with social interactions. We didn't ask them to think about any of their identities or reference stigma in any way. We just asked them to report on the different social interactions that they had that day and how they felt across those social interactions, again, both positive and negative. And then we did the traditional, we adapted the everyday discrimination scale to use in a daily study. We developed a very comprehensive introduction to that scale that really told tried to define for people how to think about themselves as intersectional, to think about all of their different identities as opposed to teasing them apart, and to report on them as specifically experiences of stigma. So the first two were sort of implicit measures of stigma, and then we did this like sort of traditional explicit measure of stigma, but with an intersectionality twist to it in terms of the instructions for that scale. It was very disturbing to do the cognitive interviews for that, because the everyday discrimination scale is by far the most used discrimination scale in the literature, and it was the one that we were cognitive interviewing and changing until the very end. Folks like just hated the items, and even the introduction, you know, we tried to develop an introduction to that scale that would help people think about how to report on themselves as folks with intersectional social positions. And the introduction, we were able to get to a place where the end of the cognitive interviews, folks like got what we were saying, but they still hated the items. Like folks really, we adapted items, obviously we modified the items, but people really still had the most issues with this scale.
I'm sorry, I had to walk out for a minute. What scale?
The everyday discrimination scale. So we created an introduction for it that was intersectional as opposed to thinking about like specific identities. So we told people, think about all of your social positions,
Right.
But they did not like the items.
John, can you give us an example of an item that was problematic?
I cannot, because they just like really did not like almost any of the items.
Are you gonna write about that?
Yeah, so we are working on a paper that will both talk about the cognitive interviewing process and also present the quantitative data from the pilot study of the scales themselves.
Yeah.
Yeah, and so the last piece that I just want to talk about is intersectional stigma as the association and not the variable. So based on the interviews, it was clear that it wasn't that, for example, Black sexual minority men experience a greater frequency of stigmatizing events than white sexual minority men, but rather that the impact of those events is much more strongly negative because they don't have the opportunity to shift into spaces where they can forget about those things. So that they're just much more pervasive, even though they're not more frequent. So they're not necessarily experiencing more stigma events, but when they're in a space, they're reporting less safety across the spaces that they were in that day than white sexual minority men. So sort of going back to the first few tables where I showed you the association of stigma on affective outcomes, we're now actually starting the process of analyzing the data to look at these implicit measures of stigma, where we don't actually talk about it as stigma. We just ask people to report on their feelings within their spaces that day and their feelings within the social interactions that day. And we're looking at how those feelings are associated with outcomes like affect or substance use. And the idea, which we have yet to fully test, is that, again, it won't be a difference in the level of reported stigma in those social spaces and social interactions that day, but instead it would be a stronger association. So intersectional stigma would be manifest in a stronger like slope between that scale and the outcomes of interest than a higher score on the scale itself. So that's kind of the next process that we're going into now that we have the scales and have the data from that pilot study. And so now I'll talk in my presentation later today about the Unite cohort study that we did that was a nationwide study of 8,000 sexual minority men. We just got funded a few months ago to do the next iteration of that from the Light 2 funding mechanism. And that one we are now focusing exclusively on Black, Latino, and multiracial participants. And we are going to have a 3 times every week diary in that study using these scales. So we'll actually have these daily diary data on 5,000 people that we'll be using to inform that study to look at how state level policies impact these daily experiences. So we're going to have these really cool within-person data on daily experiences of intersectional stigma, and then we'll be able to look at how the different state level policies may or may not inform those. So now we're looking at the intersectional stigma as an outcome as opposed to as a predictor. Basically, saying that like the experience of intersectional stigma is like well demonstrated to have health impacts Now it's time to look at like stigma as the outcome as opposed to the predictor. What are the factors that are leading to stigma that we can intervene upon through policy and advocacy?